Ruby's lost weight again this week. I'm not able to get her to eat much at all, and she doesn't like the high-calorie drinks.
Thanks for letting me know, Kate. I think Ruby is starting to deteriorate. She's had dementia for many years, and she's certainly changed from that active person that first came to live here. I'll ask her GP to review her. Thank you for agreeing to meet with us, Joy.
I guess you've seen some changes in your mum recently.
Yes, she's so sleepy and won't even eat her favourite foods. The family have been ringing me to do something, so I was very glad you rang.
Deb rang me with her concerns. I've examined Ruby and done some routine blood tests. There doesn't seem to be anything acute and reversible happening. So, sadly, I think Ruby is starting to deteriorate and may not be with us for much longer.
That's what I thought. She wouldn't like to be like this. You know how active she was despite the dementia. She was always a busy woman.
Yes, I think the best thing for us to do is to keep her as comfortable as possible. If she's unable to swallow, as she deteriorates further, we can start using the new medication. Some drops administered under the tongue to ensure she remains settled. I'm going to prescribe these now, just in case. I'll also prescribe some medication for pain, though she seems to be comfortable at the present.
We will keep a close eye on Ruby and make sure she is comfortable. Please reassure the family that it is normal to stop eating at this stage of her illness. We won't weigh her anymore as we can't reverse the weight loss. There's no need to continue to check her temperature or blood pressure given her deteriorating state. And please reassure the family she won't feel hungry. As she continues to deteriorate and approach the end of her life, she is likely to stop swallowing. As Dr. Noble has said, we can keep her comfortable with drops under her tongue, and if Ruby has any pain, we can give her this by a small plastic needle under her skin. We will keep her mouth and lips clean and moist with wet swabs. I'm going to give you some written information about the dying process for you to share with the family. No matter how prepared we are, this is always sad. We'll look after Ruby. We know how precious she is to your family.
Ruby wasn't responding last night. She wouldn't take her medications at 1800, so the EN commenced the drops. She rang her daughter who's gathering the family and they'll be in soon. Her respirations are really rattly. They sound terrible. We wondered if we should use suction.
Thanks, Kate. I'm glad they've contacted the family. They'd hate to miss the opportunity to say goodbye to Ruby. Suctioning won't help those secretions. We need to open her airways by positioning her on her right side.
Oh, we tried to reposition her, but she groans as if she's in pain.
We need to change her position to keep her comfortable and reduce the secretion noise. Let's give her something for pain 15 minutes before we turn her. I'll insert an intimus subcutaneous needle in her abdomen and give her some analgesia now. Okay, the analgesia should have worked by now. Let's position her on her side. We're just going to make you comfortable, Ruby. I'm going to moisten your lips and put some lanolin on. Please make sure we keep her mouth moist and put some lanolin on her lips. Let's do her hair and make sure she's comfortable and peaceful. Her family will be in soon, and we mustn't forget this is likely to be the last time they see Ruby. Her grandchildren are just young teenagers, and we want them to remember Ruby as being peaceful and comfortable. Joy, can we have a quick word outside? I prefer not to talk about Ruby in front of her, as we're never sure how much she can hear and we don't want to cause her unnecessary distress. We are still explaining all the care we are giving to her. We are giving her some pain relief prior to turning her, so she's comfortable. She has a little plastic needle under her skin, which we will leave in, so we don't have to prick her all the time. This won't shorten her life, it just ensures she is comfortable when we turn her, and we are giving her some drops under her tongue to replace her normal medications that help keep her settled.
She looks so peaceful and well cared for. Thank you.
Let the family know they can moisten her mouth and lips anytime. It's important they touch her and tell her how they're feeling. She needs to know the family are there. She'd probably like to have some of her favourite music as well. I remember she always brightened up with jazz. Make sure the kids feel okay to laugh and chat about her. I bet there are some funny memories of Ruby.
There are.